Gretchen Zablocki here, back at East Tennessee Vascular with Dr. Assadnia for week 2 on our Stroke Awareness Month. So last week we talked about signs and symptoms and when to get treatment. And this week we wanted to touch a little more on causes, prevention, and then treatment, and then even tell you about a screening that Dr. Assadnia does here. So tell us about some of the causes and then some of the prevention that people need to be aware of as far as a stroke.
Again, thank you again for coming over here and talking about this important subject.
Yeah.
Okay. I think the key that we have to understand is that we live in a part of the country that this disease is very prevalent. Okay. And why do I say that? We live in a place that we have a lot of patients who have high blood pressure, they have high cholesterol levels,
Yeah.
They have diabetes, they're smokers,
Yes.
and all those things lead to developing disease processes that could lead to a stroke. Okay,
Yeah.
so I think, like you said, there are a lot of preventable things, and it starts out from your family practitioners, from your primary care physicians who work on your blood pressure and making sure that the blood pressure is being within a normal range. Because
Right.
when you have high blood pressure, not only it causes damages to all kinds of organs, but it also damages the end vessels in the brain, meaning the small vessels in the brain,
Yeah.
which could lead to stroke. Okay, so that's important. High cholesterol, diabetes, and smoking, they go hand in hand. And what they do is they do damage to the vessels going into the brain. So one of the things that I see the patients who've had stroke is when they have what we call carotid artery disease. Carotid arteries are the main vessels that feed the brain.
Yeah.
So if you're smoking and if you have diabetes, you could be blocking these, and a piece of that plaque could break off. And when that piece of plaque goes to the brain, guess what? You end up with a mini stroke or a stroke. What we call a TIA
Yeah.
is the same thing as a mini stroke, which is the difference between a mini stroke and a stroke is that when somebody has symptoms, if they last less than 24 hours, it's considered a mini stroke.
Okay.
But it's a warning to you. Okay.
Yeah.
But if it lasts more than that, it's a major stroke. Okay.
Okay.
So when somebody has a mini stroke, it's telling you that, hey, you could have a higher risk for having a massive stroke. Get to your doctor, and then we look for the causes for it. If it's hypertensive, then we need to bring the blood pressure down.
Right.
If it's their cholesterol high, we need to work on that. We need to talk to them about quitting smoking, exercising, watching what they eat. But the biggest thing is, if you have a blockage in your carotid, then you're going to do the same thing. And if it's a blockage that is greater than a certain amount, we have to clean it out or put a stent in there to prevent this happening to them again.
Okay.
So that's where we will have to go after a symptom like that. In fact, if you've had any of those preventable things that we talked about, your physician is going to look. They're going to listen to your carotids.
Right.
They're going to try to see if you have what we call a bruit. A bruit is a kind of a funny sound in the artery, which shows that you may have blockages in there. And if they see that, all they have to do is a very simple test.
Okay.
And the simple test is what you were mentioning earlier.
Yeah.
Which is what we were talking about, screening, and they could do the screening, we could do the screening, and that is to do an ultrasound. It's a very accurate test. It's a very quick test.
Okay.
And basically you look in there, you look for plaque, you look for blockages, the degree of the blockages, see how the blood is actually flowing through the arteries, okay? And that will tell us whether it's a critical level that we have to do something about, or if it's not a critical level, but you have a minimal disease or moderate disease, and then we could work on the prevention so that you don't get to the critical level.
Gotcha.
So those are the things that we can do to help you.
Yeah.
And of course, then if it is above a level, then you ask, well, what do we do next?
Right.
And of course, I've been here in Morristown for about 16 years, and I've been doing carotid endarterectomies, which is basically a fancy way of saying that we basically go and clean that artery. We make an incision, we go down to the artery, basically clamp it, take the plaque out and close it back up.
Heard it called roto-rootering.
Yeah, well, it's a roto-rootering.
Yes.
In a way, it is, because we keep taking all the plaque out.
Gotcha.
It is actually, in a way, we're roto-rooting, cleaning it out,
Okay.
and doing that. Now, of course, there are other modalities, and the other modality would be putting a stent in there, meaning instead of going down there and cleaning it out, you actually can go in, put a stent in there, open it up. But there are guidelines for each, because there are some benefits to one versus the other one. So again, you need to talk to your specialist,
Right.
and then they will tell you, hey, I think you need this kind of modality, or if you need the other kind, and they can talk to you about the pros and cons of each one and tell you which one is better and fits you as far as long-term prevention of a stroke.
Yeah. And so let's talk a little bit more about your screening that you do here, your
Sure.
SAVE screening. So stroke, aneurysm, and vascular exams.
That's exactly right.
So tell us a little bit about
Sure.
this,
Sure.
and that it's offered, or who it's offered to.
Absolutely. Well, first of all, I mean, what I want you to know is that we're not doing this because we're like, oh my God, there's no, it's not like a money-making thing for
Right.
me. I just want you to know that this is more for us trying to prevent these things that could happen,
Yeah.
in this area. So
It's a
so
great
it's
service to the
so
community.
we, because of all the risk factors that we were talking about, and the fact that people have high blood pressure, they have the diabetes, they're smokers, they have really bad arterial disease. So people who have blockages in their legs also have blockages in their arteries of the neck that goes to the brain. They could develop aneurysms. So what we're doing with the screening is essentially we're looking at these vessels. They come in, we quickly look at these three areas the key areas that we could prevent something bad happening.
Yeah.
We quickly look at the carotid arteries and make sure that they're within a certain range. We look to see if they have an aneurysm. Aneurysm is basically a ballooning of the artery. Okay, and again, the same risk factors that we talked about.
Yeah.
And then we also look at vessels in the legs, which people, what they have, it's called peripheral arterial disease, or PAD. You've seen that being advertised on TV and everything like that. And essentially, we quickly take the pressures and look and see if there are any decreases in the pressures in the legs. And that tells us that there are blockages in it. We look at the carotids and we look at the aneurysm, and then we give them a little readout on that. And if it's abnormal, then you need further workup to treat those if a treatment is warranted.
Gotcha.
Okay? So we offer that to anybody. Of course, it's something that you have to discuss with your physicians, because sometimes they've done some of these screenings, so
Right.
you may not need that.
Right.
And I think it's always wise to talk to your primary care physician or your regular doctor to say, look, I'm seeing this screening. Have you done any of these things? If they haven't done it, if they say they want to do it, again, our goal is knowledge. Knowledge
Yes.
is key.
It's power.
Knowledge is power. That's exactly right. So
Yeah.
so you don't have to come here. If they don't have the ability, or if they don't have any ability to get to somebody to do that, we'll be more than happy to do that. We're doing it at certain times. You can call and make those appointments and all that stuff, and we could do that for them. But
Right.
but that's up to between them, their family members, their physicians, and we could offer that for them to make a screening for them.
Great.
Okay.
So much great information, Dr. Assadnia, and thank you. Just remember, guys, 80% of strokes are preventable. So again, with that healthy diet, exercise, quitting smoking, managing that high blood pressure and diabetes, make sure you get in, see your primary care physicians. If you're interested in the screening, give us a call here at East Tennessee Vascular and we'll get you set up. Again,
Great.
thank you for your time.
Thank you, Gretchen. Thank you very much.
Have a great Wednesday.